Welcome back to our 2025 Health Sciences Career Day. The next healthcare profession that we're going to look at today is respiratory therapy. Please watch this short video from Clarinda Regional Health Care Center.
Good morning, Janice. How are you doing today?
I'm fine. How are you?
I'm good. I'm Susan with Respiratory. I'm going to do some checks on you, and I'm going to put a BiPAP on you today, okay?
Okay.
This should help with your breathing a little bit, all right? My name is Susan Gray. I am a respiratory therapist, and I work at Clarinda Regional Health Center. Clarinda Regional Health Center is a critical access hospital, which means we're serving a small rural community. The patients that we see have limited access to larger facilities. Some of the challenges our patients have are transportation, distance from home to healthcare provider. Providing these services here make it much more accessible to them to get the healthcare that they need. I got into respiratory therapy because I knew I wanted to go into some sort of healthcare. I wasn't sure what I wanted to do. I was a kid that had asthma and an athlete and kind of had some experience as a kid with some respiratory therapists and thought it was pretty cool. And I knew that I wanted a job that was going to be secure and flexible with what I wanted to do in life. A typical day is I get here, I open my computer, check to see what kind of patients we have that are on the floor, inpatients, gather their medications. I also look at my schedule for the day for my outpatients. I go down to the floor, see the patients, converse with the nurses about what's going on with those patients. Come back, get set up for any sort of outpatient test I might do, including pulmonary function testing, home sleep studies, stress testing, get that all set up. I'm also answering the phone constantly because we are on call for the ER. We go to traumas, we go to anything that they might need help with breathing issues. We do arterial blood gases to see how people's blood is transporting the oxygen in their blood. We do BiPAPs, CPAPs, life supports. Conditions we most often deal with are COPD, asthma exacerbations, pulmonary edema, lung cancer, chest trauma from accidents. The most rewarding part of the job is the continuation of care with patients and seeing them improve over time. A lot of times they come to me when they're at their worst and we do a pulmonary function test, and then they go on to do treatments, pulmonary rehab, have their surgeries or do their chemo, and they come back to me and things are improved, and it's nice to see that what we're doing is helping.
All right, joining us is respiratory therapist Susan Gray, Chief Inclusion Officer Maggie Brown, and Certified Athletic Trainer Logan Wood from Clarinda Regional Health Center. I'll turn it over to you guys.
Good morning. Welcome to Clarinda Regional Health Center. My name is Maggie Brown, and I just wanted to let you know Clarinda is a small town in southwest Iowa. So if you can imagine a triangle between Kansas City, Omaha, and Des Moines, that's kind of where we're located. It is very rural, and we are considered a critical access hospital, which means we are licensed for 25 beds. So even though we're a small hospital, we still have similar departments, just on a smaller scale than the city hospitals that you may be used to seeing. One of the cool things about working in a small hospital is that you get to take care of friends and family and maybe people you've known, and people find that very satisfying. And the other thing that's pretty neat about it is that if you're unsure kind of where you want to work and you're not sure if you want to specialize, you can work in a small town hospital and learn kind of some variety of things. It's some broad knowledge, but it can help you like discover and identify where you're really comfortable and where you want to be in the future. So my role is, my background is nursing, but the other cool thing about a small town hospital is does leave a lot of opportunity for growth. And so now I am in a role where I'm over HR, but also some other clinical departments as well. So that's been great for me. Now I'm going to turn it over to the star of the video, which is Susan.
Hi, my name is Susan Gray. I'm a registered respiratory therapist. I have been working in healthcare for 20 years. I earned my Associates of Applied Science in Respiratory Care, and I'm credentialed through the National Board for Respiratory Care. I spent the first 10 years the first 10 years of my career working in a level 1 trauma center in Kansas City, where I primarily worked in the ED, the critical care unit, and the neonatal intensive care unit. I also spent a couple of years managing a long-term ventilator care unit. And for the last 9 years, I've been here in Clarinda, working at Clarinda Regional Health Center. Like Maggie said, it's a critical access hospital where I do a little bit of everything. I get breathing treatments, I do pulmonary function testing, we set up sleep studies, we do all kinds of things throughout the hospital. An interesting part of my job here is that we take part in the asthma action plans for the local athletes here in town, which brings me to Logan. He's the athletic trainer here at the hospital and the high school. So we work closely together in dealing with the breathing issues for these students that he deals with on a daily basis.
So my name is Logan Wood. I'm the certified athletic trainer here at Clarinda Regional Health Center. I am contracted out to the local high school, Clarinda High School, here in town. So I am out there every day working with those athletes, working with those students on all of their health issues. My number one priority is always try to prevent issues from happening. So working with other people here at the hospital has been fantastic. It allows us to, with the close knit that we are, being a smaller hospital, yet we have all of the same departments, just like Maggie said, just on a smaller scale. We work very closely together on their things. So as Susan said, if we have someone who maybe they didn't know that they had some breathing issues until they started participating more in extracurricular activities once they got to that junior high, that high school level, I can kind of help coordinate that care with their primary care physician, and then with respiratory therapy on performing some PFTs and then working on those asthma action plans.
Thank you. So our first question, if you guys are ready for questions, is how long does it take to become a respiratory therapist, and what does that education look like?
You can do it, all of the gamut. So I have an associate's degree of applied science. You can get a bachelor's, you can get a master's, but the basic is the associates of applied science. I did 2 years of prerequisites as far as sciences and your basic studies, and then I did 2 years of respiratory care school.
Okay. And what kind of, if a high school, junior high student's interested in becoming a respiratory therapist, what kind of courses do you suggest they focus on in high school, or is there things that other courses they can take in high school to get more prepared?
I mean, much like the other hospital jobs you guys have listened to, sciences, anatomy and physiology, some mathematics, biology is good. I would suggest maybe doing a CNA course if you could, so that you could get into the hospital and kind of see what the different areas do and what you might decide you would like. When I started my job in the hospital, I had never worked in a hospital, and it was very eye-opening. So it is nice to kind of have an idea of what you're getting into before you start school.
What made you decide to become a respiratory therapist?
I knew I wanted to go into healthcare. I thought I originally wanted to be a dental hygienist, and did shadow in a dental office for a summer, and decided that that was not for me. I didn't know that I wanted to be a nurse, and I just had some experience with some respiratory therapists and thought that that would be a good fit for myself. And it has been, because I've done nothing different in my adult career.
Does your organization offer shadowing opportunities for students interested in becoming a respiratory therapist?
Absolutely. Yep.
And how, if they were interested, how would they go about finding out that information?
So they can contact our human resources department. We do a lot of coordination with the school in a lot of capacities, but that's one of the things is some of the classes there offer students to come, and they can, look at a variety of the departments and job shadow there, or else they can, if there's something that they really think they're interested in, then they can be designated to one area. We do, find it helpful for them to come and get a good understanding of what goes on, and encourage them, if they have the opportunity to take some local community college classes while they're in high school. That's always a benefit, because they get those credits early, and it carries on into their college career.
So as a respiratory therapist, what does your schedule look like?
A typical daily schedule here at Clarinda looks like coming in, checking the med-surg patients on the floor. They have scheduled treatments generally from 8, noon, and 4 for the day. Sprinkled in between those med-surg patients, we have outpatient testing such as pulmonary function testing, setting up home sleep studies, Holter monitors. Today's Thursday, we do stress tests on Thursday mornings. So we usually see 3 to 7 of those patients on Thursdays. And then we're also fielding calls from the ER and other departments if they're needing things done immediately.
What is a pulmonary function test?
So, a pulmonary function test is a series of breathing tests that we perform that can help determine the disease process that a patient is dealing with. It measures their total lung capacity, how well they react to a bronchodilator, or if they're having bronchospasms, where they're at in their disease process with either lung cancer or COPD, anything. We do them for a range of things. We also do them for pre-hiring for particular jobs. If they're going to be wearing respirators, we check their lung function before they start their job so that they know that they're at a good baseline before they start those chemical-based jobs.
What kind of equipment do you use during the day?
Tons of equipment. It's a lot of equipment. Ventilators, the home care or the home sleep study equipment, EKG machines, the pulmonary function machine. It's a very equipment-based job. So a lot of piecing things together, a lot of understanding how the equipment works.
And what does a ventilator do?
A ventilator breathes for you. So we put those on patients that are in a critical situation. They aren't breathing on their own, or they can't breathe on their own because of medication. So we do intubation, put a tube down their throat. It's what a lot of people would consider life support.
Okay.
It's life support, so it breathes for the patient.
Okay. What are your interactions like? And this is for everyone at the table. What are your interactions like with other members of the healthcare team? How does respiratory therapy kind of fit into that healthcare team?
I really like it because I know everybody in the hospital. I'm not confined to one unit. I work in every part of the hospital, and we go to all the care team meetings every day. I deal with the outpatient clinics. I deal with specialty clinic. We deal with surgery. We deal with the floor. We deal with ER. So we are very involved throughout. So it is kind of nice to not be stuck just in one area and only know the 5 to 10 people I work with every day. I kind of know a little bit about everybody in the hospital. How about you, Logan?
I would agree. Yeah. I just feel like here, especially here at Clarinda, we have a great relationship between departments, which makes it super great for all of the patients because that helps us provide the best care for them. We may not be able to do exactly what they need in our department, but we can coordinate with the next department to help them get that care, or the other department to figure it out, all to come together as one team to give the best care to the patients that are needed.
I'll just say from an HR standpoint, we work with respiratory therapy when we're onboarding new employees. They do fit testing, and so respiratory therapy helps us with that. And the other thing I wanted to mention was during the COVID pandemic, which we all remember, respiratory therapy was a key player on that, and they were in high demand and running around.
Yes.
Running the butts off all the time.
Yes.
So do you have on-call hours? And then also for Logan, what do your hours look like as also covering high school sports? I'm assuming you cover many of those as well. What's that kind of schedule look like with work-life balance for the both of you?
For me, because this is a smaller hospital, in a larger hospital, there are respiratory therapists in the hospital 24/7 because we are smaller. I do take call. We are here from 8 to 6 p.m. So after 6 p.m., I take call until I'm back the next morning. And we have a few therapists that rotate call. I don't get called a lot, but when I do, they need me, and I come in as soon as I can, and I can be here from 10 minutes to 3 to 6 hours. It just kind of depends on the patient that we're having. Logan?
For me, work-life balance with athletic training, it's a little bit of you have to be flexible because you never know what the schedule is going to be. You never know what Mother Nature's going to do as well for events. So my schedule currently, I also help teach a college class out at the high school. So I do that in the mornings. I do intro to sports medicine. The reason I got into that was just to try to help kids see the other avenues within the health facility that they could get interested in, to give them a little bit of background in those professions. I don't focus on just sports medicine, even though that's in the name of the class. I bring other people from the hospital out there to try and give them a chance to hear other professions and possibly give them an avenue to go. So after I do that, I do treatment and rehabilitation with kids who are having injuries there at the school, trying to prepare them throughout the day if they have a break in classes or whatnot, and then just preparing for practices and events that occur after school. So my schedule is always different. You never know what you're going to get from one day to another. So having a calendar that you can change things, move things is really nice to have, because you never know where you're going to be at or what event's going to be going on, and with all of that. So
Maggie, when a respiratory, so if someone has graduated, they are now a respiratory therapist. When they're applying for a job outside of their degree, what else are you looking for in a candidate?
Someone who kind of fits the team. We always want to, of course, get feedback when, like if it was here, we'd have Susan, for sure meet with them and see who really fits best within that capacity. It's one thing to meet the qualifications on paper, but really meeting the person and trying to get their personality. Also, confidence is really important when in a small hospital, because again, sometimes you're the only one here and you really have to be confident in your skills. And so that's another thing that we look at.
And then kind of along that same line, what I think it was on one of your slides in your video, but what is the salary range for respiratory therapists?
So 52,000, I think, was what was on the slide. And so, yeah, $26 an hour is kind of where that comes in at. And that may flex a little bit depending on the size of the hospital and the location in the area. But that's kind of the starting range that we're looking at.
Okay. And then we got a question. The pandemic was brought up. So during that time as a respiratory therapist, what was your biggest challenge? Was it taking care of patients, public education? What did that entail for you as a respiratory therapist?
It was, being a smaller hospital, we obviously didn't get hit as heavily as some of the larger cities, but just making sure that we were prepared. And I worked very closely with the CRNAs and anesthesia to make sure that if we ran out of ventilators, if we needed them, how we could piece everything together to provide the care we needed for the community until we could get, because a lot of times we couldn't send them out. If we intubate here and have a ventilator, a lot of times we will ship them to the city where they can get more access to more care. We weren't doing that then. We were keeping them here. We were doing it all ourselves, and it was just being sure that we had everything we needed, that we could get what we needed, because supplies at that time were also difficult to get. And just the unknown, because very early on we weren't sure what was actually working, and it took a lot of trial and error to figure out what was getting patients through and why they were surviving or why they weren't surviving. So just a lot of that unknown was the most difficult part.
And then for your job, what are stressful situations look like? When is it an emergency? How do you interact in those type of situations?
A code, which means someone's not breathing, their hearts has stopped. We get that pretty often in the ER. A family member finds a family member down, ambulance brings them in. We're at the head of the bed. We are bagging them, giving them, we are the airway, we are giving them breaths. We are assisting and helping with intubations, which is when you hook them up to life support. We are doing CPR. We are doing all of that. So we always say that we're chest up. Anything that's up here, we are in charge of. Okay. So being able to communicate well, being able to perform under pressure is huge, and knowing your limitations and when you need to ask for help.
Okay.
Yes.
And then, sorry, I lost my train of thought. For a student who's interested in respiratory therapy, what is something you'd give them as advice or a tip or a trick to help their pathway go smooth as they're starting to enter into school? This could be for all three of you as well.
Like I said, I hadn't been in a hospital other than as a patient, so I would recommend job shadowing, trying several different departments, seeing what might fit well. I thought for sure I wanted to be in a dental office, and then I figured out I did not want to be, and that wasn't right for me. So I went into respiratory and decided that was probably where I wanted to be.
Okay.
I would agree. I would say getting your feet wet in an area, trying a lot of different areas. You might think that you want to do one thing, but then, like Susan said, you'll get there and you'll be like, oh, maybe this wasn't for me.
Yeah.
So being open-minded, yes, understand that maybe you want to go into the health field or into a different field, but get yourself into that position and try it out, and at least go watch what is actually happening in daily life and not just reading about it type of situation.
Yeah, it's not all like on TV.
Yep.
Not like all the medical dramas.
No.
Yeah.
And then we did have a question from one of our schools. You mentioned an EKG. What is an
Yes.
EKG and what does that do?
An EKG is an electrocardiogram. We hook stickers up to your chest and it reads the tracing of your heart rhythm. So we can tell a lot about your heart rhythm and what kind of arrhythmias you might be having, tells us how you're reacting to particular medications, what kind of health you're in, that sort of thing.
Okay. And then for respiratory therapists, you've talked about it, as an inpatient hospital setting. Are respiratory therapists used in different levels of healthcare?
Yes. Asthma and allergy clinics, they have them there as an outpatient clinic settings. You can do home health care settings, sleep studies. That's a huge thing. They're very hard to come by, people that do sleep studies. You can do all kinds of things. Home health care, like I said, is outside the hospital.
Then we got a question. When someone comes in with a collapsed lung, what do you do?
Put in a chest tube.
And what does that do then?
So that you put in a chest tube, it lets the air out and helps reinflate that lung for them to breathe.
Okay. Any other words of wisdom you'd want to share with our junior high and high school kids who are interested in this field?
Again, just exposure, getting out there, going and visiting any opportunities that you have to visit your hospital or to work in a hospital or just to be around and get your medical terminology in there and understand some of those things. And that's probably the most helpful thing I can think of.
I would say don't be afraid to reach out. There might not be something formally set up between a school and a facility or even in that town, but don't be afraid to reach out to people. There's very few people who would be willing to talk to you about their profession and help you understand more about it. So don't be afraid to actually reach out to them and have a little bit of a conversation and just tell them that you are interested in it.
All right. Well, I want to thank the three of you for your time this morning, and we thank Clarinda Regional Health Center. We are now going to watch a short video about the Iowa State's STEM BEST program, and then we'll resume our next session at 11 a.m.
Discover the power of partnerships with the STEM BEST program. This innovative initiative brings together students, teachers, and industry professionals to create dynamic curriculum and projects that prepare students for exciting STEM careers in their local communities. The STEM BEST program offers real-world experiences that develop future-focused, high-demand skills. Since 2014, 139 STEM BEST program models have fostered community collaborations, creating leaders and innovators for a future-focused Iowa. Join us in shaping the future of STEM education and empowering the next generation of problem solvers and trailblazers. Learn more about how you can be a part of this transformative journey today at educate.iowa.gov.